Hello, I'm Ronald van Vollenhoven. I'm a professor of rheumatology in Amsterdam in the Netherlands, and today I spoke at the European Lupus Congress about targets. That's what we try to achieve. In the first place, I talked about for the patient. We wanted the patient to have as little symptoms of their disease as possible, to be in remission, and we also use an actual definition for that so as to be able to measure it. But I did plead to the clinicians to really focus on that and try to achieve that for each and every patient. Then I talked about the clinical trials, where you also need a target, but that's actually because you want to also know in the trial of a new drug, is it really working? You have to be able to measure it. And there we run into some paradoxes. Some trials have failed or have given very strange results, which makes us suspect that the outcomes we use, the targets we use in the trials are not so good. So there's now a lot of international initiatives to try to come up with better outcomes for the trials. And I think in the next year or two we'll see some important developments. And the last thing I mentioned is that for the toekomst, we're also for the future, we're also hoping that some treatments can put the patient in a remission where the disease is gone and where they don't need to continue with all kinds of treatments. It's a hope that we have for as many patients as possible. I'm afraid it won't be possible for every patient, but at least for some, and we continue improving on that.
All right.